some of the other anatomy of the eye, there's a fibrous layer, and that, if you've ever seen the actual white of the eye, that's called the sclera. And the sclera is the fibrous layer in the white of the eye. The cornea limbus, that's the border between the cornea and the sclera. The vascular layer is the iris. That contains the papillary muscles that change the diameter of the pupil. Another vision abnormality is called color blindness. It's commonly an X-linked recessive trait. 8% of the males have it, and 0.04% of the females have it. If you look at this image, you should be able to see the number 74 in green. Now, one of the things that the eyes are able to do is they can dilate or constrict. The pupillary dilator muscles extend rapidly away from the edge of the pupil, and contraction of these muscles enlarges the pupil. In the picture on the right, the pupillary constrictor muscles form a series of concentric circles around the pupil when these sphincter muscles contract and the diameter of the pupil increases. When there's more light or increased light intensity, the pupils constrict, get smaller, and when there's less light, the pupils dilate and get bigger. Now let's go on to the inner layer of the eye. The outer layer of the eye is called the pigmented part. The inner layer is called the neural part, or the retina, and it contains visual receptors and associated neurons. The rods and cones are types of photoreceptors. The rods do not discriminate light colors, and it's highly sensitive to light. The cones, on the other hand, provide color vision and are densely clustered in the fovea at the center of the macula. In the inner chamber, there's something called aqueous humor. The fluid circulates within the eye and diffuses through the walls of the anterior chamber into the sclera venous sinus, and it re-enters circulation. The intraocular pressure, the fluid-filled pressure in the aqueous humor, helps retain the eye shape. The large posterior cavity, or the vitreous chamber or cavity, contains the vitreous body. It's a gelatinous mass, and it helps stabilize the eye shape and support the retina. A cataract is a condition in which the lens has lost its transparency. Again, a cataract is a condition in which the lens has lost its transparency. This is an illustration or an image of a cataract. The way we rate vision is called 20/20. So visual acuity is clarity of vision, so normal is called 20/20 vision. Myopia is called nearsightedness. If the eyeball is too deep or the resting curvature of the lens is too great, the image of the distant object is projected in front of the retina, and the person will see distant objects as blurry and out of focus. The opposite of myopia is called hyperopia, and this is called farsightedness. And this is when the eye is too shallow or the lens is not focused properly, and hyperopia will result. Older people become farsighted as the lens loses its elasticity, so hyperopia is corrected with a converging and convex lens. There can be surgical correction for myopia and hyperopia. This has been achieved by reshaping the cornea. There's a type of surgery called PRK, photorefractive keratotomy, and this is where a computer-guided laser shapes the cornea to the exact specifications. There's a variation of this called LASIK, laser-assisted in situ keratotomolysis. In this procedure, the interior layers of the cornea are reshaped and then recovered by the flap of the original outer cornea epithelium. About 70% of LASIK patients achieve normal vision. LASIKs become the most common form of refractive surgery. There's something called the circadian rhythm. It's tied to the day-night cycle, and it affects the metabolic processes. This is usually connected with the brainstem and the visual processing and the occipital lobe of the brain. Optic refers to eye. Otic refers to ear. Getting eye drops and ear drops mixed up is probably not a good idea. Make sure you know this picture of the ear and the general parts. Let me highlight some parts. We have the auricle, we have the external acoustic meatus, we have the tympanic membrane, we have the tympanic cavity, we have the auditory ossicles, we have the cochlea, we have the bony labyrinth, and then we have cranial nerve number 8, the vestibulocochlear nerve, and then cranial nerve number 7, the facial nerve. The external ear is called the auricle. It protects the opening of the canal and it provides directional sensitivity. The external ear, we have the external acoustic meatus. It ends at the tympanic membrane or the eardrum. The tympanic membrane is a thin, semi-transparent sheet, and it separates the external ear from the middle ear. The middle ear begins at the tympanic cavity. It's also called the tympanic cavity. It communicates with the nasopharynx via the auditory tube. It also permits equalization of pressures on either side of the tympanic membrane. Enclosed are the 3 auditory ossicles and the 3 bones, the malleus, hammer, incus, anvil, and the stapes, the stirrup. This shows you the 3 auditory ossicles and showing you the tympanic membrane and the tympanic cavity and the middle ear. Hearing is very important to us just as sight is, or vision. The auditory ossicles convert pressure fluctuation in the ear into much greater pressure fluctuations in the perilymph of the cochlea. There's something called a frequency of sound. That's determined by which part of the cochlear duct is stimulated. There's also something called an intensity of sound. That's called volume. And that's determined by the number of hair cells that are stimulated. Know frequency of sound and intensity of sound, or volume. Pitch is another definition. It's our sensory response to frequency, and it's a part of the pressure wave. Amplitude is the intensity of the sound wave, and sound energy is reported in decibels. We can use a tuning fork, and this illustrates how the sound waves here generated by the tuning fork travel through the ear as pressure waves, and then we hear it via the tympanic membrane and the auditory ossicles.